Thanks for your company. The Korle-Bu Teaching Hospital has suspended emergency referrals. The decision, according to authorities at the hospital, follows the congestion at the facility. Health workers at the surgical and medical emergency unit of the Korle-Bu Teaching Hospital are warning the Ministry of Health directive against hospitals turning away patients could have even more dire consequences on the country's health sector. The hospital reports and doctors are concerned the current state of affairs predisposes both health workers and patients as well as their relatives to greater risks. Maxwell Agbagba was there on Tuesday.
The surgical and medical emergency units at the Korle-Bu Teaching Hospital is virtually bursting at the seams as lots of patients receive their intravenous fluids on plastic chairs. Some of them have no choice but to sit on kitchen stools to receive treatment. Here at the surgical emergency units of the hospital, I met one Fati Janat. Her child was brought here to this facility with a cardiac arrest. Later in the evening of yesterday, she had no choice but to find solace on the hard concrete floor at the hospital.
Was in critical condition, cardiac problem, all the way from Kaswa in an ambulance. When we entered, in fact, there was no bed, but they didn't say so. They said they had been told not to reject anybody. So they admitted us, tried whatever to resuscitate her. But she was lying on the floor wailing. There was nothing they could do because there was no bed. I went home in the night around almost 12. My grandchild called me and said they've been asked, all of them have been asked to come and sleep outside because other patients were being brought and there was no place for anybody to sit. We were just hanging around her. He was lying, rolling herself. Girl called me and said they've been asked to sleep outside under a staircase. If I became too worried, somebody with a heart problem, if something happens in the night, the nurses are not around. So my grandchild wept all night while the girl was wailing. Today too, we came to see her sitting on a plastic chair. You see? You have seen her condition now. It's deteriorating.
I've been speaking to the public relations officer of the Korle-Bu Teaching Hospital, Mustafa Salifu. He says the directive that the hospital should treat all emergency cases has further aggravated the congestion situation here at the Korle-Bu Teaching Hospital. He says they have communicated to all sister clinics and hospitals not to make any referrals to this facility until they are able to deal with the congestion situation.
This is a 36-bed facility unit. But as of yesterday, the patients that we had were in excess of 60. So it means we have literally doubled the number of patients we should actually have at the SME. So that was why we had patients on chairs and some of them were even outside. This morning there was one patient, but fortunately the person has been moving because until space has been created for the person to move. So that is the situation we find ourselves in. But the moment what we are going to do, we are linking up with other hospitals to inform them not to refer. They can do telephonic consultations to give them guide on how to deal with those except the dire emergencies that they will still speak to us and then we take them. We want to do this for 48 hours to allow the place to decongest so that we can start receiving. And spaces with creators, they have all been moving now, but you still have patients sitting on chairs receiving treatment at the SME now, as I speak to you now. But in order to deal with this, there are certain measures that we have taken as a hospital. As we went, maybe we'll move there, we'll see the emergency that we'll be moving in before the end of this month. That will provide us an additional space. It will literally double the number of beds that we have here at the new place. We started planning for a bigger place almost 10 years ago. That is the Acute Pain Management Center. So that will substantially deal with the problems we are being confronted with at the moment.
Well, that was my colleague Maxwell. Definitely will bring you updates on this today.